The cost of living is soaring, literally, and a new study revealing that the amount of Americans spending $50,000 or more a year on medicines, that group up 63%, and those spending more than $100,000 on medicines or more a year, each year, tripled from 2013 to 2014. Joni, before we get into all the drugs and biologics and everything else, this has got to be impacting the benefit managers out there big time, because somebody's got to pay for all this expensive medicine.
Absolutely. It is impacting the employers and ultimately impacting employees. And the data and the forecasts are showing that because of these rising costs of these specialty drugs, which are brilliant and, fighting cancer and many other diseases and helping people live longer, but it's going to have a big impact overall on the cost of medicine and health care. So it is directly coming back to employers, the health plans, and ultimately the employees will pay higher health care costs.
So, Heatha, this goes back to, again, why isn't the economy growing? Is that where we're spending our money on? If we're not going to retail, are we just going to big pharma?
I think that has a lot to do with it. I mean, what are you going to spend your money on if your health costs are rising? I mean, health is the most important thing in your life, right?
But we have Obamacare now. It's going to take care of everything.
Right. Well, I also wanted to point out, too, a lot of these companies, like Mylan, for example, has patents on things like the EpiPen. And it's these patents that they keep regenerating, and they're allowing them to raise the prices because there's no sort of competition for companies like Mylan. So it's these companies, too, that really have an issue. They just will refuse to let anyone have any competition in there to bring that price down.
That's capitalism.
It is
that's capitalism. What are you
and what detriment is it to people
Mylan's a generic company. There could be another company, if they can make a profit, would actually enter that in that line. It's probably that the EpiPen is going at margins that are really razor thin at this point. Here's the thing. The thematic for healthcare spending is going to continue to increase as the aging population continues to get older. 16% of our population is over the age of 65. And thank you very much, because if it wasn't for the 16%, then the 84% wouldn't be there. That's going to increase to 21% in the next 15 years. So continuation of healthcare spending in the United States, so it's going to continue to grow. So what do you do as an investor?
Well,
what you do is you overweight your portfolio within healthcare, and you can look at companies like Abbott, Merck, as well as Mylan, for example.
Well, I make the comment, Chris, about Obamacare. You made a comment about it, but, instead of tongue-in-cheek on that, it was supposed to help, and the president said it was going to reduce your costs. It's not doing that. We are getting an older population, so there's going to be more of that. But there's also going to be the threat of the government doubling down and saying we're going to regulate the price of medicine.
Yep.
We're going to let you buy it from Canada or some other place.
Well, I think this is the direct value of a PBM, like Express Scripts. They're driving costs down out of the healthcare system. That is their value. That's why they need to be there as an independent, participant in the healthcare cost. There's been issues where people have argued that they make too much money, but they are the ones that are driving down the costs. Look at what they did with Gilead. They kept them off the formulary. They are a part of of solving the issues here. So we're a big fan of the company, and if you want to play it, that's one to be involved in.
Meantime, we got to talk about getting involved. Make sure to tune in to Making Money tomorrow night, because Charles, well, he won't be here. He and the crew, guess where they are? They're out in Las Vegas at the Money Show, and they're going to be live from that show. They'll have investment lessons for you, and we'll be answering questions from a live studio audience. That's tomorrow night at 6 o'clock.